and welcome to Medical Dialogues. I'm Yakshi. Let's look at today's top medical news. Levels of vitamin B12, folate and homocysteine in patients with obsessive-compulsive disorder, study finds. According to a study published in journal Neuropsychiatric Disease and Treatment, it is known that elevated serum homocysteine, decreased folate and low vitamin B12 serum levels are associated with poor cognitive function, cognitive decline and dementia. Current literature shows that some psychiatric disorders, mainly affective and psychotic ones, can be related to the levels of vitamin B12, folate and homocysteine. These results can be explained by the importance of vitamin B12, folate and homocysteine in carbon transfer metabolism, which is required for the production of serotonin as well as for other monoamine neurotransmitters and catecholamines. Patients who were diagnosed with OCD according to the 4th edition of the Diagnostic and Statistical Manual of Mental Disorder criteria were approached and informed about the aims and methods of the study. Among the patients, the ones who did not have mental retardation and psychosis and the other ones who provided their informed consent were enrolled in the study. Other exclusion criteria were defined as the history of any endocrinological condition, being pregnant, lactating or having childbearing potential, having clinically relevant abnormal laboratory test results including megaloblastic anemia, alcoholic abuse and dependence and a positive history of immunologic disease. 22 healthy control subjects who matched with the patients in terms of sex and age were chosen from the hospital staff according to exclusion criteria. Study finds the role of diet and supplements to be significant in cancer prevention. A study published in a journal Cancer Screening and Prevention. Cancer is a complex multifactorial disease with a substantial global burden. Recent years have seen a surge in research focusing on preventive measures, particularly through diet and supplements. The role of nutrition in cancer incidence and prevention is widely recognized, though the specifics of these relationships remain unclear investigation. This review expands on the findings of Anandu Chandra Khanashyam, exploring the nuanced links between diet, supplements and cancer prevention. The significance of diet and supplements in cancer prevention is well documented, with nutrition being a key factor in cancer incidence. Shifting from nutrient-centric approach to examining overall dietary patterns offers a more comprehensive understanding of diet's impact on cancer risk. Healthy dietary patterns, characterized by high intake of fruits, vegetables and whole grains, are associated with a lower risk of cancers, particularly colon and breast cancer.
Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possess in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below.
Study reveals the antidepressant effects of curcumin in patients with obesity and type 2 diabetes. In a recent study published in journal Nutrient, type 2 diabetes mellitus is a chronic condition marked by elevated blood glucose levels due to pancreatic beta cell dysfunction and reduced insulin action. T2DM and depression have a bidirectorial relationship with affected individuals facing challenges such as disability-related job loss, non-compliance with medical treatment, and heightened mortality risk. In this double-blind, placebo-controlled, randomized controlled trial, researchers addressed the depression-lowering effects of curcumin in 227 obese individuals with type 2 diabetes mellitus. The study emphasized the role of curcumin's antioxidants and anti-inflammatory properties in elevating serotonin levels. Participants were individuals aged 35 and above who had received a T2DM diagnosis within the past year. Healthy lifestyle habits significantly reduces the long-term risk associated with COVID-19, study finds. In a recent study published in the journal Nature Communication, researchers investigated that association between alterable lifestyle factors and complications after having coronavirus disease 2019. Long COVID affects a range of systematic diseases or symptoms across 10 organ systems including cardiovascular, coagulations, metabolic, gastrointestinal, kidney, mental health, musculoskeletal, neurologic and respiratory disorders, as well as general symptoms of fatigue and malaise, several impacting the quality of life and daily life. Researchers aim to fill a critical knowledge gap by examining how a combination of healthy and lifestyle factors, particularly regular physical activity, a healthy diet, and avoid smoking, might reduce the risk of developing long COVID symptoms across various organ systems. The study considered factors like infection, severity, vaccination status, and different COVID-19 variants. Thank you for watching. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.